very troubling development. What can you tell us? How much is known about it?
So we knew there was a potential for coronavirus to cause brain damage from SARS in 2003 and MERS in 2012, but the numbers were small. And then when the first papers came out from Wuhan in early January, they suggested about 36% of patients in their group had neurological symptoms. But what was not clear was whether these neurological symptoms were because of low oxygen levels, or the patients were very sick with sepsis, or there was actual brain damage in these patients. And so our study, which was set up to look at these complications, found that some patients presented with inflammation of the brain, and as you intimated, this may be due to overstimulation of the nervous system. These are sort of conditions we've seen before, particularly in children after virus infections. A larger number of strokes than expected, and although some of these patients were elderly, they had vascular risk factors like high blood pressure, diabetes, or irregular heartbeats. A number had no real risk factors, and it seems that in COVID-19 patients, the blood is much thicker and stickier than you would expect. And it may be that the virus actually affects the lining of blood vessels, so there's a double whammy risk for causing strokes. And then these patients with delirium, which means confusion or disorientation, and in these patients, scans are normal, and what it is really software malfunction of the brain, either due to low oxygen levels or sepsis, or again, maybe a combination of all these things, including the immune system. The final group we had was the patients with Guillain-Barré syndrome, which is, again, a well-recognized neurological condition after virus infections where you get weakness in the legs falling up to the arms. But I would say that, the numbers are small, and this was a very highly selected group of patients that we were studying.
And I want to ask you, too, it sounds so terribly disturbing, but these cases that you're seeing, is it in the very sick who have coronavirus?
No, so some of the very sick ones on intensive care units certainly had these, but we had a number of patients where the respiratory infection was relatively banal or mild, really. And so I think the message is that in any patients now presenting with these sort of neurological syndromes, one must think about COVID-19 as being a potential risk factor, and one must check the patients for these.
Yes, because I was going to ask you, how does this complicate the care that doctors and hospitals provide, and what will they necessarily have to look out for now, determining any brain issues?
Yeah, no, I mean, I think, obviously, apart from keeping aware of these neurological complications, the other problem are practical ones. So if you have somebody who's on the intensive care unit on a ventilator, getting an MRI scan can be difficult because not all hospitals will have the facilities to do scans on ventilated patients. And then you've got the problems of cross-infection, transferring patients from one place of the hospital to another is risky. So there are practical difficulties, but I think if doctors and physicians are aware, then they can look out for these complications, which makes looking after these patients very difficult. And that's why I think we need more research, more studies looking at the underlying mechanisms so we can actually develop rationale treatment for these complications.
And because this disease, doctor, has only been around for a few months, how long could it take to determine the long-term damage that this may cause with brain function?
Yeah, no, I mean, this has been explosive. Look, I was a junior doctor when the AIDS epidemic started in the early 80s, which came on gradually. This has been explosive, but I must say that our knowledge and expertise and cooperation in the last 3 to 4 months has been phenomenal. So, I think there are a lot of now publications coming through of people's experience that I think one will develop rational treatment and protocols for this very complicated group of patients.
Well, we thank you so much for your time and your expertise on this troubling development as it is. Dr. Hadi Manji in London. Thank you so much, sir.
Thank you very much.